Hello, I'm Rob Robson. I'm happy to have a chance to talk with you briefly about the SPHERE workshop. It was created to help with critical incident review training in healthcare facilities. This is a particularly appropriate thing at a time when 1 out of every 13 patients admitted to an acute care facility in Canada will experience an adverse event associated with unintentional patient harm. It's also appropriate in Ontario as a result of recent legislation, specifically Regulation 965, which requires that all hospitals have in place a system for the mandatory reporting of all critical incidents, as well as the mandatory review of the critical incidents and incorporation of the lessons learned in the annual quality and safety plan for that facility. Who might be interested in coming? Well, any frontline providers, all physician and nursing managers, as well as unit supervisors, anyone with an interest in risk management, the quality and safety officers, and any leadership personnel who have responsibility for quality and safety planning in the facility. At the end of the workshop, you will learn specifically how to investigate a healthcare critical incident. And you will have gathered knowledge and understanding that will contribute to your facility's organizational quality and safety plan. At the same time, you will come up with specific recommendations and insights that will help to reduce and mitigate the risks for patients in the future and will help to strengthen organizational resilience. The way in which the workshop provides this training is through practical skills and techniques which are applied by the participants through the review of multiple case studies. The overall approach adopted by the workshop is what's called a systemic nonlinear approach, and this is particularly appropriate for complex adaptive systems, the type of systems within which healthcare is now provided almost everywhere in Canada. Based on my direct experience with the approach promoted by the SPHERE workshop, I am convinced that this will be helpful to organizations in terms of their obligations towards quality and safety planning. I am sure that it will be of assistance to direct care providers in terms of their understanding of the multiple contributing factors that lead to unintentional patient harm. And most importantly, this will be important for patients because it will reduce the risk of recurrence in the future. I look forward to having you participate in the workshop, and if you have any questions at all, please don't hesitate to contact us. Thank you.